Hi, I'm Kaushik Mukherjee from Loma Linda University, and my study is called Sleep Time for Sedation Level After Emergent XLAP Without Primary Fascial Closure, Time to Closure. Damage control laparotomy is the standard of care for many critically ill and injured patients after surgery. After DCL, it is important to rapidly achieve primary fascial closure to avoid further complications. Traditionally, this has been accomplished with deep sedation or neuromuscular blockade, but these interventions can result in delirium and physical deconditioning. The effects of sedation level on rates of PFC, delirium, and other outcomes have not been well studied. We seek to use a multicenter retrospective cohort to determine the confounder-adjusted effect of sedation level on time to PFC after damage control laparotomy for trauma and emergency surgery. We also seek to determine the confounder-adjusted effect of sedation level on surgical complications, delirium-free, coma-free ICU days, and ventilator-free ICU days. We hypothesize that light sedation is not inferior to deep sedation in terms of achieving primary fascial closure, and that light sedation is superior to deep sedation in terms of the proportion of coma and delirium-free ICU days. We hope to have a cohort of 310 patients to demonstrate non-inferiority with 90% power, but 400 patients would be ideal to maximize generalizability of the study. In our preliminary data, we showed that prescribing practices for deep sedation vary significantly with surgeon experience, and in a single-center cohort, we demonstrated that shorter sedation exposure was not associated with prolonged time to primary fascial closure in a trauma population. Furthermore, we also demonstrated that longer sedation exposure was associated with a decrease in the proportion of coma-free, delirium-free days. Our study includes adult patients with an open abdomen after trauma or emergency surgery with daily recorded RAS and CAM-ICU scores, and will include patients from January 1st, 2017 through the end of 2018. We believe this is a novel research question which has implications for change in treatment of patients. It is already IRB approved, and we plan to use an easy REDCap-based data entry system. We plan for abstract submission to EAST by July 1, 2020. Thank you for listening, and we hope to have your participation.